Welcome to The Current by TreasureCoast.com, where we discuss interesting people, places, and happenings on Florida's Treasure Coast.
Well, Dr. Rothman, thanks so much for joining us. It's really a pleasure to have you on and to talk a little bit about Cleveland Clinic, Indian River Hospital. Let's start maybe by talking about who you are, what you do, and the hospital.
Yeah, thanks so much, Josh, and thank you for having me, and thank you to your listeners. As mentioned, my name is Rick Rothman. I've been here on the Treasure Coast now going on 12 years. I'm an internal medicine physician, actively practicing in acute care, hospital-based medicine. I've had various roles since I arrived here in Florida. I was part of the Indian River Medical Center prior to joining the Cleveland Clinic. I've had the role of the Chief Medical Operations Officer for Cleveland Clinic, Florida, um, the Vice Chief of the Integrated Hospital Care Institute, which is a large institute and a mix of contracted and employed physicians, about 500 of them across the Treasure Coast, caring for patients in the acute care setting. Um, and now I'm back here as the physician leader, the Vice President and Chief Medical Officer for the Cleveland Clinic Indian River Hospital here in Indian River County.
That's fantastic. So most of your care, I guess, is in this hospital setting. Most of your experiences is in this setting, and
It is.
it's great that you have the. It's interesting to me talking to people who have experience before it was Cleveland Clinic. A lot of the Martin North, for example. I'm here in Stewart right now. Before it was Cleveland Clinic, and people have maybe a perspective of how things have changed or how things are improving or what's coming up down the line. Um, do you want to talk a little bit about? I know Raquel had talked about maternity services and that kind of thing. Do you want to talk a little bit about the current state there and what that looks like for the average person?
Yeah, sure. Yeah, yeah, and I think I'll make a more general comment as we think about the Cleveland Clinic here on the Treasure Coast. Um, in 2019, there was a tremendous investment in the caregivers across the Treasure Coast, Cleveland Clinic,
Yeah.
Indian River Hospital, the Martin North, Martin South, and Traditional Medical Center, with a deliberate effort to reimagine how care is delivered and to improve patient outcomes. And I think that's so important today because when I first started practicing medicine, the when I first started practicing medicine, the top priority was patient outcomes. Um, if you were sick and you needed care, how likely were you to improve because of what the healthcare system offered? And that was the outcome that mattered most. If I had a cancer and I needed a
Mm.
surgery, was the physician going to walk in and tell me they got all the cancer? If I needed open heart surgery, was my wife going to know that when I got an open heart surgery, I survived? My heart is better, and I'm going to continue to live a long life because of the intervention that the physicians and the healthcare system offered. We're in a much better place today with regards to those outcomes than they were in 2014. I think that's important to call out. However, the way we digest the perception of healthcare today is different. It's no
Yeah.
longer defined by how likely I am to have a good outcome. It's defined by how quickly do you answer the phones? When I walk into the facility, did I get a warm meal? Was I discharged on time? That holistic approach is so important that I want to keep in mind that the outcome measure that matters most has improved across the Treasure Coast. As an example, neonatal mortality, meaning if you were to deliver a baby at Cleveland Clinic Indian River Hospital, what is the mortality rate? There's a recent publication by Healthy Starts, and much of this data is public, that showed the Cleveland Clinic Indian River Hospital population, where we deliver about 75 to 80% of all babies in Indian River County. If you came in, visited one of our obstetricians, and delivered at the Cleveland Clinic Indian River Hospital, the rate of death of that baby was 80% lower than residents of the county that delivered somewhere else. Reflect on that for a moment. You're 80% more likely to have your baby survive a delivery here than like facilities for residents of Indian River County. Yet, when we read about the hospital and we talk about healthcare today, we're not discussing that. When I get calls every day, if you call me Josh and you say, Rick, I need care. And the first thing that comes to my mind is, what is the condition? Who are the physicians and the teams that can deliver the outcome that matters most? Maternity services are being reimagined across the country. And it was unfathomable 15 years ago to think about hospitals that would stop delivering babies. The reality today and the macro environment is such that we're in a place where hospitals are juggling the ability to sustain their operations and maintain all of the services that they've offered in the past. And because of that, maternity services across the country have come under tremendous pressure for a combination of reasons. Some of it is around the reimbursement. In the state of Florida, we know that the sociodemographics of those delivering babies tend to pressure the finances of a maternity unit. And when we say finances, we're not talking about it in terms of making a profit. We're discussing finances in terms of, can we sustainably offer the service? And there's a difference there.
Yeah.
Right? And so when we discuss those things, I just think it's so important to put that in the context. This is not the hospital systems, any hospital system saying we want to make a profit on delivering babies. What the hospital systems across the country are saying is, we have to decide, can we continue to lose $15, $20 million a year in a maternity unit that could potentially compromise our ability to provide routine emergency department services to the community? We're fortunate in Indian River. Cleveland Clinic Indian River Hospital, as mentioned, delivers, depending on the year, 75 to 80% of babies in the county. Those 75% have an 80% lower mortality rate than the other 20%. The team has done yeoman's work around providing the best clinical care to patients with the best outcomes. With that, we're not immune to those macro headwinds that are putting financial pressures on labor delivery units across the country. We're very fortunate in Indian River County that we have a partnership with the Indian River Hospital District that recognizes the heterogeneity of the sociodemographics influence the ability to have these sustainable community services like maternity. And so with that, we're very excited about the potential to continue to grow labor and delivery services here in Indian River County. As an example, we're in the process of a $7 million renovation of our labor and delivery unit that will not only match the world-class care that our patients are receiving to the environment, but it'll also allow for the patient's experience around this care delivery model to continue to improve. It's important, I think, for all of these components to be put into context, Josh, as we start to think about where we were 10, 15 years ago. How do we reimagine these services? Look, we don't want to stop delivering babies. It's the most exciting thing that happens in our hospital every day. There's a music that plays 5 or 6 times a day at Indian River Hospital every time a baby's born. And it's one of the few times where you could walk onto any floor, even the floors that are most critically ill, and see smiles on everyone's faces. We're here to sustain that, but to do that, we have to have some of these difficult conversations.
Yeah, that's an interesting perspective, or I guess a way to kind of frame this, because you're right. A lot of people, maybe they tend to get their information or their data or the way they look at things is kind of maybe shrouded through, you know, conversations about their insurance company or insurance premiums or things they see on social media, and it's not always maybe data or, you know, real objective things that they can maybe be proud of about places that they're their local hospital. And I'm interested to hear, from your perspective, what are some of the biggest challenges, with maternity, with OB or labor and delivery, or otherwise, with the hospital, and what are some of the challenges that you see every day, or some challenges that have been that they're overcoming now?
Yeah, the perspective of, I guess I'll take a step back and say that as the front facing entity for healthcare in the community, we are going to get all of these questions, right? And it's fascinating when you start to really think about it conceptually. In what business would you get a call from a patient, in this case, our customer, our client, complaining about another business, right? And so we pick up the phone and we start hearing about, why is the insurance company not covering this?
Yeah,
And
very interesting. Yeah.
why is this happening? And it's fascinating when you think about the psychology behind that, in that we're here to deliver the care. Um, there's contracts between the insurance companies and their healthcare plans and the individuals that they provide those plans to. But the conversation, when there's a discrepancy, often happens at the interface of the patient and the hospital. And so the I think we have to take that all into context as we think about, how do we reimagine care so that we're not in a situation where we're constantly trying to justify whether we do it or don't do it. It's, how do we ensure we're successful in delivering healthcare in the community together? And to do that, what conversations do we need to have?
Yeah, I think that makes sense. I mean, even in, Indian River County, which it's probably a smaller county than others in Florida, um, it's almost like there might be more pressure, being one of the only, you know hospitals that does what you do, whereas there are other places where there are multiple, maybe hospitals they could go to. Do you think that plays a role in it? Maybe I'm asking that question a little bit odd. Hopefully you understand what I'm.
Of course, right? Yeah,
Okay, okay.
that's the kind of the. It's. I'm reminded of being in New York City with my grandparents, and we'd
Mm.
go to this diner all the time, right? And it was the diner that everyone went to, and there was a couple smaller ones around, but this is where you wanted to go. And by the way, if everything wasn't perfect, you complained about it. But when it was perfect, boy, you left there feeling really good.
Right, right.
Um, at the Cleveland Clinic, I'm very excited and engaged around this idea that the expectation and the bar is set much higher. And so when patients come into us, they're expecting not just good clinical outcomes, right? That's the foundation of why they're seeing us. They're expecting a better experience, a more compassionate experience, and the one that takes into account their safety, the quality of the care we deliver, and their long-term outcome. And so we are held to that higher standard. Um, Indian River, as an example, we are the largest community-based hospital in Cleveland Clinic, Florida. We are the only 3-star STS rated open heart surgery program in Florida. We have some of the best open heart surgery outcomes in the country to match these great neonatal outcomes. And I say that because they're contrasting services, right? But we're doing them both really well. The rates of delivery in the county, we expect over time, will increase as the municipality expands, right? The birth rates are a function of a number of things. However, it starts with the number of people that are migrating into the county. And so if we're anticipated to deliver about, the Indian River residents will have deliver about 1,200 to 1,300 babies next year. That's up slightly, about 2% from this year. As the influx of new residents into the county increases and the demographic becomes younger, we would expect exponential growth for maternity services. there's some rationale behind why there probably aren't other hospitals that are saying, geez, we're going to open our doors to maternity services. One, to be able to provide these services with the help of the district, there's a supported loss of about $7.5 to $8 million a year for the labor and delivery services
Okay.
and the outpatient services to deliver them. We're really fortunate in that we have said that with the hospital, with the work of the Indian River Hospital District, we're going to work together to ensure we have these services here in the county as the county grows. Recognizing that there's probably a critical threshold where you start to deliver many more babies. Put this in a context, St. Lucie County delivers somewhere between 3,000 to 4,000 babies a year. Martin County, much less. We're doing about 1,200, so somewhere in the middle. We expect that to grow at a rate of somewhere between 2 to 3% a year over the next 10 years. Over the next 5 years, I'm sorry. So compound annual growth rate of about 10%, which sounds great, right? But it's a growth rate from a base of 1,200. And so as we think about, well, when do you start to offer NICU services? NICU services, to have NICU services, what that means is that there's enough preterm deliveries that a hospital, to provide care for the community, would open up a neonatal intensive care unit for those preterm deliveries. What's so interesting and what was recently published by Lisa Zonner, what I think is a really good article, which was to say, what is the actual rate of requiring a NICU and for the Indian River County residents? Number is 4%. So on 1,200 deliveries, 4% of them probably require a NICU. So if we do the math on that, you're probably talking about 50 deliveries a year. So that means one baby a week would be in a NICU. That's much different than an urban center or the delivery centers that you would see in areas like Fort Pierce, where that number is probably closer to 15%. And so as long as the preterm delivery rates are low, there's not necessarily a need for a NICU. And we provide services based on the community need. And so there's always this conversation around, well, what is that backup support needed? As an example, we're an open heart surgery program here. We don't offer transplant because the rate of patients that would fail their open heart surgery and then require emergent transplant is very, very, very low.
Right.
And so when the community need exists, we would be very excited and bullish on expanding our service offerings. But we want to be sure that we're doing it in a way that's sustainable, right? So that nurse that's in the NICU is seeing more than one baby a week.
Yeah.
Right. Today we're delivering those, call it anywhere from 3 to 5 babies a day, and so they're really delivering a lot of babies in there. But those babies, we're not finding they need the level 2 NICU, and that's great. And the reason for that is it matches why the mortality rates, again, that's for the 800-900 babies we deliver, is so low. While the county neonatal mortality rate is higher for the non-Cleveland Clinic Indian River population, it's because the perinatal care is so good, right? So we don't see a lot of preterm deliveries. They're doing a wonderful job in the obstetric side to ensure that mothers are healthy. They're getting the right counseling from day one, the right coaching, the right medical treatment, so that by the time they deliver, they're at term and their babies are not high risk. Ultimately, that's the goal. And again, back to heart surgery, the goal is to not need heart surgery. Here,
Right.
the goal is to not need a NICU. And so that's kind of that discussion around, well, just go stand up a level 2 NICU. Well, sure, we can go stand up a level 2 NICU. There wouldn't be any babies in it.
Right.
Today.
Right.
Hopefully that's helpful for your audience. And it's sometimes
Yeah.
it's hard to conceptualize. It's kind of if you're building a house and you say, geez, I'm going to build my house. But I don't know how to swim. I'm really scared of swimming. But once a year, somebody comes and visits who loves to swim. Are you going to put a $100,000 pool in your backyard?
Right. Right.
It's the same concept in that we want to be able to ensure that we're meeting the demands of the community. And the moment that we see we're not and we can't, and the community needs higher level services, that's why the Cleveland Clinic is here. And I hope your audience here, we're 100% committed to that. And I wouldn't be surprised if we do the same interview, 5 to 8 years from now, that we are talking about a level 2 NICU. But it would take delivery volumes significantly higher. I hope we're not. I hope our delivery volumes get significantly higher, and the need for a level 2 NICU goes down, which means we're doing a great job on the perinatal side.
Right, right. Yeah, I think that's an awesome perspective because it definitely makes me think about things very differently. We had talked with Dr. Drake, and they had mentioned how, I think that they are a level 2 NICU now in tradition. Um, and anything, level 3 and above, they go to Nemours. Um, and so that's an interesting perspective. I'm interested to hear, do other Cleveland clinics, would that have any effect on, like, let's say Cleveland Clinic tradition developed a level 3 NICU there. Would you say, well, hey, look, we've got a level 3 NICU that's kind of closer. Okay, the population is growing. Maybe we still have a pretty low percentage of babies that might need NICU care, but we've got tradition close enough, so maybe that prolongs our need for something like this. Maybe that would have a similar effect for something like a transplant, where if you've got a partnership or something nearby where you can kind of rely on them to prolong your need for, to have to develop that in house. Is that something that you look at, or am I kind of off base there?
Absolutely. I think it's, no, I think it's such a sus. I think all large healthcare systems are looking at how do they ensure they can do this sustainably to meet the demands of the patients. And irrespective of how large a facility is, we're doing that across all of our service lines, right? And so whether it's a hospital that has a very robust labor and delivery unit, but they don't have the ability to provide geriatric care because they don't have an aging patient population. So where do you go if you need
Yeah.
that geri site care? And how do you develop that? On the labor and delivery side, while tradition to that point as a level 2 NICU, we continue to partner and on an annual basis do reviews with our Nemours, with our partners in Nemours. And I just want to comment on that in that we have some of the lowest neonatal mortality rates to be delivered. And then you have one of the best
Right.
pediatric centers in the world to partner with for that neonatal intensive care if needed. And that's the way we're approaching it. And so if
Mm-hmm.
our partners in Nemours looked at this and said, we believe there's a need, it's different than we know we can support it. We believe there's a need for this. I think that would lead to the discussion of, okay, would we want to do it here? Do we also want to do it in tradition? Do we have Indian River as a level 2 and tradition as a level 3? Do we have Nemours stand up in its own NICU services?
Got it.
What
Yeah.
would that look like? And that's an exciting conversation to have. But
Right.
again, that's where we have the benefit of the partnership with Nemours. So you have some of the top obstetricians delivering you at the Cleveland Clinic, plus you have some of the best pediatricians and neonatal intensivists, and we have one here on site all of the time to ensure that the patients are getting the best care. By the way, that's how you lower mortality rates. That's how you improve outcomes. That's what matters most. And so I get what's in the papers and the things that people read. And from my perspective, um, we want to ensure that what matters most, which is good patient outcomes, a great experience while patients are under our care, that we can continue to deliver on that. We can't change what goes in the newspapers. And we want the community to know that insofar as care is concerned, this is the best place to deliver a baby, certainly on the East Coast of Florida.
Yeah. That's I'm glad you clarified that, and you're right. That is an exciting conversation, I'm sure, for you guys to have, because it's exciting for me. Exciting for me to hear, things like that, and to think about the future of these different areas on the Treasure Coast and what's going on there. I'm interested to hear, to touch on, if you'd like to, maybe some other things like the emergency room, stroke, any data you have there. I know we talked a little bit about cardiac and heart. I think open heart surgery is what we talked about before. Do you want to touch on anything outside of, the labor and delivery and OB stuff that might be um, interesting?
Yeah. So absolutely. So
Okay.
let's talk about kind of healthcare in general and we want to ensure that we're providing accessible care to all patients. And we want to ensure that patients understand, we're transparent about how we're delivering that care, where we see the opportunities, and where the challenges are with regards to how care is delivered. And very often, we get I get a lot of phone calls around, well, can't get in to see said specialist. And what's happening in the healthcare market is the number of physicians that are going into certain specialties is declining.
Mhm.
And that's happening in parallel to a rapidly aging population, such that the demand for services can't be met by the supply of physicians today. And so while what we're doing is everything we can to expand access to bring physicians into the community. We recently brought in 5 new oncologists, in addition to 3 radiation oncologists in the cancer center, to ensure we're meeting that demand. As an example for cancer, we have in Indian River County the only true beam radiation units to deliver radiation therapy for patients with cancer in Indian River County. And what that means is that the radiation we deliver has much lower side effects. It's much more exacting, millimeter precision. Patients aren't having the same scarring that they used to have from radiation therapy. And so it is by far the best place to receive radiation care, probably on the Treasure Coast. In addition to that, with 5 oncologists, we have one of the most robust now cancer centers on the Treasure Coast. We're committed to heart care, and we're in the process of standing up our Brain Health Center, which is a cognitive health center to ensure aging patients have a place to go for things like memory loss and support, care of Parkinson's disease, and other disease states such as multiple sclerosis. And so we're really committed to ensuring that we're delivering the care the community needs. We love the feedback. It's very helpful, and certainly understand some of the frustrations that the patients feel trying to interact with healthcare systems from the outside looking in. It can be extraordinarily frustrating. We're doing everything we can to make it easier.
Yeah, I mean, I'm sure that it can be frustrating. I'm sure there's constantly, like we had mentioned before, a lot of moving pieces. What do you think? How can the average person, let's say they're in Indian River County or they're a patient at Cleveland Clinic, how can they get reliable information, or maybe how can they find out more about what they can expect? Expectant mothers. I wonder how many of them are privy to some of the statistics you put out, or people who might have cardiac issues. How many of them are aware? Or maybe somebody who has cancer, are they aware of the resources there? How can people get some of this information? Is it talking to their doctors? Is it something that happens in the room, or how can people become more privy to some of these things?
It's a combination of the best marketing tool for healthcare systems is our patients' outcomes. When a patient says, I had head and neck cancer, and I went into the Cleveland Clinic in New River Hospital, I saw one of their head and neck surgeons. The head and neck surgeon performed surgery. I went to the cancer center, and just yesterday I was deemed cancer-free. That is the best marketing tool that we have.
Yeah.
The same is true for labor and delivery. For the 900 mothers a year that we deliver babies for. That's 75% of all the deliveries in the county. Those are the voices that matter most. I would add, though, too, with maternity services, the other thing that's happened that has pressured systems is for-profit maternity practices have partnered with for-profit hospitals, such that when you go to a for-profit practice, they're looking at the hospital that they have a contract with. So practice, you go to see a practice and you say, I'm delivering a baby. And they say, well, why don't you go to Fort Pierce to deliver? There's contractual arrangements that move those babies out of the county, despite the fact that the need for a level 2 NICU in this county is so low. And so I just say that because there's a lot of complexity to what's out there today that most of your listeners probably don't fully have visibility into. They feel like it's the Cleveland Clinic doing that. I can promise you we're doing everything we can to reverse those trends. But I thank you so much for your time today, Josh, and your listeners, Darm. This was wonderful, and hopefully we can do it again.
It really was fantastic. And again, I appreciate you coming in.
that's a wrap for this episode of The Current by treasurecoast.com. If you enjoyed the conversation, be sure to subscribe so you never miss an episode. You can find us on Spotify, Apple Podcasts, and YouTube. Follow us on social media or visit treasurecoast.com for local events, tips, and news. Have a guest or topic you'd love to hear on the show? Let us know at treasurecoast.com. Until next time, keep riding the current and enjoying everything the Treasure Coast has to offer. See you soon.